The Lifestyle Show, presented by Selina MacKenzie.
It is one of my favourite times of the month and the first time this year. Welcome back to the show, Dr. David Deardon.
Happy New Year to you.
Feliz Año Nuevo.
Yeah. Well, yeah.
No, is it Nuevo or Nueve? Nuevo.
Isn't it wonderful? Eh? We've got here and the sun's shining and it's January. It's amazing. I was in England last week and the rain was coming down. It was dark and it was still January.
Oh, David.
So I'd rather be here.
Don't tell me. I'm flying to England tomorrow and apparently they're expecting storms. I know. Couldn't have picked a worst time.
I know. But no, it's, the great thing about going to England is you can always come back.
That's very true. As long as the flights aren't grounded, yeah.
Well, exactly. You don't get diverted to Malaga. Well, you go to Malaga probably. We get diverted, so it's rather interesting for us. We never quite know where we're going to end up.
Crikey, it's a worry. Yeah. Well, anyway, we're going to be talking about celiac disease today. Some people know about it, some people don't, and so I'm going to go over to you. What exactly is it?
Well, it's a very interesting question. Celiac disease is a condition quite close to my heart because a very good friend of mine's daughters both developed it, and they developed it when they were quite young, and they became international athletes subsequent to having it developed. So the diagnosis. So celiac disease is a condition which is brought about by an inflammatory reaction that develops in the small bowel or small intestine. And remember we've talked about this before, inflammatory reactions or allergic reactions, or inflammatory reactions, it's triggered by proteins. And these proteins are found in wheats and barleys and various other sort of plant or grasses. And they're called prolamins. And there's a whole variety of them. And collectively they're called gluten. Yeah. So these proteins are in these wheats, and these wheats these plants that we eat that are used in a lot of the food we eat. So things like rye and barley and wheat, they get ingested, and if they cause an inflammatory reaction in our small intestine, the top part of the gut, the bit below the stomach. And then that inflammatory reaction starts to damage the lining of the bowel or the lining of the intestine, and then the intestine starts to misfunction or not function properly. And then, as a consequence, the person with the problem can't absorb really important nutrients, and those nutrients make you sick or ill. So that's what it is. And that's how it works.
Blimey, I would imagine if you're not getting the nutrients, you'd be absolutely shattered, wouldn't you?
Well, that's part of the problem because, the people get things like anemia. They don't absorb a lot of very important minerals, vitamins, iron, etc., etc. And so they get a variety of symptoms that tend to be related to these problems. And they get iron deficiency anemia, they get vitamin D deficiency, they get upsets in their ions, their electrolytes, calcium deficiency, and these can lead to lots of problems. Obviously, they vary depending on the degree of this inflammation. They also vary according to the age. So a lot of celiac disease is diagnosed in very young children. And clearly these deficiencies in childhood can lead to stunted growth, rickets, problems with kidney function, etc., etc. But if it occurs in adults, and that's the second group of people who get it, they get it in their 40s to 60s, they can get anemias and they can get all types of chronic diseases which can present as other things and eventually get picked up after the person's been backwards and forwards to the doctor for many visits.
Presumably, if you're not getting enough calcium, then can it cause osteoporosis?
Exactly, yes. It's one of the problems is that people can get osteoporosis from it. Yeah.
So a person, how would a person know? Presumably, they, as we've said, they start to feel tired. I know bloating is the side effect of celiac disease. Is that what people should be looking out for?
Well, it's interesting. A lot of people who get bloating after eating bread or wheat or so, and automatically think they've got a gluten problem or they've got celiac disease, and then they self-medicate and they self-treat themselves and put themselves onto a gluten-free diet, which costs them a small fortune. And they often don't have celiac disease. They have just some other condition that makes them bloat and feel unwell. So it's really important that people, get themselves tested. So some people will develop the symptoms you've described, the abdominal bloating and the discomfort, but that could be due to other problems and other allergy, other issues, where people are eating various foods that are causing these problems. And so it's very difficult to decide who exactly has got celiac disease and who hasn't. It's always good to go and see someone and get yourself checked out, and the doctor will often do some blood tests, particularly to look at antibodies to gluten in the blood. But, apart from the gut side effects, the other side effects are really related to the malabsorption and the mineral problems that you get from the inflammation in the gut, weakness and fatigue, cold hands, brittle, nails, headaches, weight loss, muscle wasting, etc. But they're really quite a long way down the line, and most people present because they've got gas bloat or they find themselves bloating after they've eaten bread. But of course, only 1 in 100 people actually has celiac disease, and most people who have these symptoms have something else. They may have a FODMAP, sugar intolerance. They may have some problems with other malabsorption problems or other sensitivities to other foods. They may be eating a lot of mushrooms or onions or tomatoes, and those can all cause you to be bloated as well. So just because you bloat and you feel unwell after eating bread doesn't mean that you've actually got celiac disease.
Right, okay. So the way to diagnose it is through a blood test, did you say?
Well, in most cases, but you can have normal antibody levels. So that's part of it. And the other way to test it, or the other part of the testing, is the telescope test, to look at the bowel or the small intestine and take a sample and look at it under the microscope. But even then, those tests may be negative, and it may require repeated tests to get a diagnosis. But I think I've got to emphasize that most people who have the symptoms don't have the condition. So it's important that anybody does go to see, most commonly, a gastroenterologist or an intestinal specialist who can do the tests that are necessary.
So is there no cure? Is the answer just to go on a special diet if you have got it?
Well, the cure is a special diet.
Right,
you can't cure the condition. The condition will always be there. The inflammation to the gluten will always be there, but you can cure the symptoms. But you have to be on a special diet, and that's the problem because gluten appears in so many things, and it's very difficult to eliminate gluten from the diet completely, because we get it in drinks, we get it in various foods. And it's really important that people go through the process of checking it and making sure that they're avoiding it. So reading labels is really important, and making sure that none of the foods that are being eaten have got gluten in it. I mean, just to think of the type of foods that might have it in things like beers and lagers, vinegars. Noodles and pastas, cereals, and of course they're all used to make other things like soups and dressings and condiments and processing meat and pre-packed food, etc. So even though gluten comes from plants or from grasses, You can find it in so many foods. So, anybody that has celiac disease really should be looking at the food that they buy very carefully. And more often than not, a lot of people will start to cook their own food or be very careful where they go and what they do. But when they eat, they'll keep specific snacks in there with them. They'll have specific restaurants they'll go to because they know they're safe. And you can even these days get tests, little strips that you can test food with to see if there's any gluten in them. So
that's clever.
Yeah. So people who are very bad or who have severe disease will do that. And of course, it only takes one episode of eating gluten for the symptoms to start to come back. So you're never really cured from it, but you can avoid being ill from it, if you understand what I mean.
Yeah, I do. And am I right in thinking, David, that there's a higher rate in women than men?
Yeah, slightly. Yeah, there is a slightly higher increased rate in women, but it's not. I think there's 5% each way. It's slightly more common in women. Yes.
And is it hereditary? Do people get it in families?
Well, that's interesting. Yes, there is an inherited part of it, and it's linked to one of the HLA genes that we have in our tissues. I remember when we talked a few months back, we talked about typing tissues and actually and how we can pass tissue from humans to humans, like in the transplant.
Yeah.
And one of those HLA markers is called HLA DQ. And there's a few of the DQ HLA genes which seem to be linking through to make things more prevalent. I think so 90% of people with celiac disease have this specific DQ genetic makeup. And so, that there is a genetic link. So one of the factors that links you to getting it is having it in the family.
Right.
But we don't really know what causes it otherwise. I think even though someone may be predisposed to developing celiac disease, we're not entirely sure of the triggers that actually make it happen. There's some evidence that it may be linked to trauma or stress. People seem, or when people get it, there's often a history of trauma, maybe an operation, maybe a shocking event, maybe a car accident, maybe just a pregnancy or something. There's something happens that upregulates the genetic predisposition to start developing the allergen. And this is an area of what we call epigenetic, where the factors outside the genetic makeup of a person have an influence on developing the disease. Now, that's one theory, and then the other theory is really relating to the bacteria that sit in our gut, whether they have an effect on the genetic makeup, and somehow they start to make the inflammatory system or the immune system of the person start to react to the protein. So something upsets the balance, and if you have the genetic predisposition, you'll develop the disease. But having the genetic makeup doesn't necessarily give you the disease.
Right. And interestingly, you just mentioned pregnancy. If a woman had celiac disease and got pregnant, could it affect the baby?
Well, that's a very good question. Theoretically, not directly, but if they inherited... So the celiac disease would not affect the baby in as much as it wouldn't transfer across into the baby. But if the celiac disease was actually making the mother ill, then that would have a negative effect on the growth of the baby. So if she became malnourished or she became micronutrient deficient, then that could affect baby growth, could affect the whole development of the baby. So it's really important that someone who's got celiac disease is going through a pregnancy is very closely monitored by her doctor to to make sure that nothing untoward happens during the pregnancy. Does it mean the child will inherit the condition? Well, there's a risk, because obviously they may inherit the DQ gene from their mother, but on the other hand, they may not. So they may not get it, but certainly there is a link with inheritance through families and that.
Okay, interesting. Well, I mean, it sounds pretty awful. It sounds like, if you do find out you've got it, you've got to read every single label on food, which is really difficult as it is, isn't it?
Well, exactly that, and it's important. But what's really important to remember is that, most people say they've got gluten problems because they bloat or they have abdominal pain and discomfort, or a bit of diarrhea or a bit of looseness. And in truth, the vast majority, 99 or 99 and 100 or even less than that, actually don't have celiac. They may have a sensitivity to gluten. They may have a sensitivity to something else. They may be eating one of the many foods that can make you bloat. And must remember that gluten's not the only one. We know that sugars can do that. We know that wheat and barleys and so on contain sugars. So the reason why bread can make people bloat is not necessarily because it contains gluten, maybe because it contains other sugars, what we call FODMAP sugars, FODMAP sugars. And so it's really important if you get these symptoms that you go and get checked out.
Yeah, definitely.
Because obviously gluten-free foods are very expensive, and people can put themselves, just auto-treat themselves going on to gluten-free diets when they don't need to. What they need to do is have a very close look at what they are eating and see if you can find the bloating foods, which could be something like tomatoes or garlic, ironically.
Wow, simple as that. Interesting. Well, thank you, David. As always, I've learnt a lot. How are things at the clinic?
Very good. Yes, the clinic is open. We've got the operating theatres open now. We've got the radiology diagnostic unit open and the outpatient consultation area open. So it's good. It's early days, and the number of people coming to us is increasing. We're very happy with things as they're developing, and we're looking forward to 2025. It's an exciting year ahead.
Excellent. And how can people get in touch with you?
The best way is either phoning the clinic, which is on a Gibraltar number +350 200 4999, or you can check out our website, which is www.givmed.gi, or the Specialist Medical Clinic, which is www.smc.gi. And then both of those websites will take you to the various people that you can speak to or email to be taken forward.
Wonderful. Thanks as always. Look forward to chatting again next month, David.
And to you. Thank you for calling.
Take care. Bye.
Bye.